Ladies and gentlemen, welcome to the MedTech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So today on the MedTech Impact Podcast, we are delighted to be joined by Jennifer Law, Maternal Health Leader at Philips. Jennifer, welcome to the show.
Hi, thank you so much for having me.
We are so excited to have you. We connected at the Mass Medic Symposium. You gave a lovely coverage there of all the things that Philips is doing in maternal health. And so, of course, we're delighted you can join us today and provide some insights. Before we delve into some of the exciting things that Philips is doing, though, we do like to frame it for the audience. So please tell us, what are the big problems that we are observing in maternal health?
Thank you for that starter question. I recognize that some might say, oh, maternal health, that only applies to a small segment of the population. But our maternal health outcomes in the United States are really appalling. The US has the worst maternal health outcomes in the developed world. American women today are more likely to die during childbirth or from a pregnancy-related complication than their mothers were. So generation on generation, we are heading in the wrong direction. Maternal mortality is rising. Our C-section rates are double the World Health Organization's recommendation. And on top of that, there are significant disparities based on race, with Black women 3 times more likely to die from childbirth-related complications and pregnancy-related complications than white women.
It seems impossible to fathom in this modern age, when we have all this technology, all these amazing systems, that's even possible. If we start to scratch the surface, why is this happening?
It's so multifaceted, but I do believe that, I agree, it's shocking to people. They think of the United States as just so advanced, and we are so advanced in so many ways, but how could we be failing our moms and babies to this point? The CDC says that 84% of pregnancy-related deaths are preventable. So there's a lot of opportunity here to improve. If you'll mind, I'd like to describe the problems a little bit more deeply. High-risk pregnancies in the United States are on the rise. Today, about a quarter of pregnancies are considered high risk. And that's due to things like as simple as increasing maternal age. Women are delaying childbearing, but that moves you into the high-risk category. It could also be influenced by things like incoming or underlying factors like obesity. And then we're seeing just other pregnancy complications like hypertension, diabetes, you name it. If you are a normal or low-risk pregnancy, you're going to have 10 to 15 appointments over the course of your pregnancy, and they're going to be mostly concentrated in that second half. If you are a high-risk pregnancy, and remember a quarter are, then you might have double those appointments. Prenatal care is so important, and we all, I think, understand the importance of preventive prenatal care. But when you're asked to come in to the clinic or to your doctor, potentially every other day, that is a huge ask for a pregnant person. And I'll also like to say that access to prenatal care in the United States is a challenge. The March of Dimes has coined this term maternity care desert. It's getting a lot of press, and it's very important that it does. 36% of US counties are maternity care deserts. What does that mean? It means that there are no OB providers at all in that county. There's no OB-GYNs, there's no OB nurses, no midwives, no hospital that has a labor and delivery ward where you can safely give birth. So women are having to travel farther to get their prenatal care. But as I mentioned before, high-risk pregnancies are on the rise. It's more important than ever to get prenatal care. And so this is just a very unfortunate, challenging situation that we have in the United States right now.
And Kyle, when we hear this word again and again in healthcare, these healthcare deserts, it's crazy, these huge problems and the fact that it's getting worse. And clearly innovation is going to be the only way we're going to solve this.
This is really eye-opening, right? Because again, I think it goes back to just our perception on living in the US and, just thinking that, well, we've got the best standard of care in every aspect, and when that's not actually the reality at all, as Jennifer's described. So, Jennifer, I really am curious here, and I'm sure the audience is too. Maybe start at a higher level, and then we can get a little bit more granular and specific into the types of technologies. But let's start with kind of talking about how Philips today is currently trying to address and solve these problems. And then again, maybe we can start talking about some specific technologies.
Absolutely. So for background, Philips has a very interesting position where we have both medical devices and we also have a consumer products division. So we got ultrasounds, fetal monitors, remote patient monitoring, that's medical devices. And then on consumer side, we have the Philips Avent brand of baby bottles, pacifiers, breast pumps. And we have Pregnancy Plus, which is the world's most downloaded pregnancy app. What is driving all of these different maternal health businesses? I will point out two themes. First is access to high quality prenatal care. We are really moved, motivated to do what we can do from a technology perspective to make sure that pregnant women are able to get all of their prenatal appointments. And then at the same time, we're also very invested in health literacy and education, and making sure that people even know how important it is to do your prenatal care, but also what are the healthy behaviors that you should probably be adopting during pregnancy to ensure the best outcomes.
Mm-hmm. Yeah. And, it's really interesting there because I think of some of the things that you're referring to here in making more accessible at-home health. So maybe, talk a little bit more about what those technologies look like today and how they're, helping provide more access and better, higher quality prenatal care.
Yeah, so I'll start by going back to what a prenatal care regimen should look like. So you've got the 10 to 15 appointments. You'll have a couple of ultrasound scans. If you're high risk, you'll be asked to come in for like surveillance. It's basically like monitoring, just to check on the welfare of your fetus. And traditionally, ultrasounds are these huge cart-based devices. They're not transportable at all. They're expensive. You have to travel into the city to the hospital to get an ultrasound done. And same with fetal monitoring. If you're a high-risk pregnancy, you'll be commonly prescribed something called a non-stress test. It's just a monitoring procedure, but the machine is like a fax machine. It's large. So again, you'll be traveling in for these appointments. And we have been working on technology that takes those large machines and makes them more portable, therefore more accessible.
And I'm imagining, this is really to help with any kind of early, detection or diagnosis or something, right, that could be happening to the pregnant mother, right, so that doctors and physicians can address those challenges earlier, right, to provide better treatment in a more proactive manner.
Early deterioration detection is so important for everyone, but especially for pregnancy. Mm-hmm. Every day matters. I'm not a clinician myself, so keep that in the back of your mind. But that is the ultimate spirit behind prenatal care, is that we're trying to identify potential complications before they become emergencies, because there are certain interventions that could be done or lifestyle changes that could be done. But if you don't know early on, then you just lose out on the opportunity to make that difference.
And tell us a little bit more too about Pregnancy Plus. You started to, get into it being, one of the most popular downloaded apps that pregnant women are using today. So how does that work? And what are the benefits to, the patient?
So today, when a person finds out that they're pregnant, or probably even if they just think that they might be pregnant, one of their most common behaviors is to download a pregnancy app. And there are a bunch of them out there. I think maybe a generation before, they would go and buy a book, like what to expect when you're expecting. These apps are, they provide information by week. So, be like, oh, you're 12 weeks along, your baby is the size of a plum. Here's what you might expect at your prenatal appointment. Here are some questions you might want to ask your provider. Remember to, get a lot of sleep and exercise and, just answer some of those basic questions. So this is a global app. We're 22 different languages, but one example I think is really compelling about how this app is being used in a really innovative way is Pregnancy Plus's partnership with Michigan Health and Human Services. So states, they know that we have an issue with maternal mortality. And our government has invested enormous resources in creating all kinds of programs, home visiting programs, mental health programs, doulas, you name it. The challenge that they experience is getting the attention and getting enrollment into those programs, because it can just be very hard to, you're only pregnant for a short period of time. Like, how do you find that woman, in the couple of months when you really need to enroll her? But they're already downloading an app. They're already downloading Pregnancy Plus. So our partnership with Michigan is to create custom content for any mom who is in Michigan. She, downloads the app. She indicates that she's, she lives within like the zip codes and she's on Medicaid, and then she'll get she'll get custom content that basically just connects her and makes her more aware of the local resources that she has. So that's in its second year right now. We've had some really wonderful data to, for instance, 80% of users said that it did help connect them with local resources, and it has helped drive over 1,000 Medicaid eligible home visits.
Oh, that's fantastic. You can totally sense and hear, Richard, too, the community building here too, and this almost personalized approach, right, to giving these pregnant mothers the opportunity, right, to tailor, right, that pregnancy process or that journey, right, to their specific needs and where they are, where they're located. It's really neat.
Yeah, and I think that partnership, I cannot overemphasize how important partnership will be for making a dent on maternal mortality and morbidity. We sit from the perspective of technology. So we have an amazing app called Pregnancy Plus, but it's really when we combine it with others in the ecosystem, like government in this case, that we're able to, really start to move the needle here. So I think that's a theme I'll probably come back to a few times because I really do believe in it.
No, but it's so true. And I think, as much as we're all patients and we're talking about certainly here for maternal health, we're all consumers of content. And so I think building trust is such an important part of being able to reach those people and for them to know and trust and believe in the technology and the innovation that's being brought to them. And then coupled with that, all these other resources that you're trying to promote through this platform. So it's amazing to hear about the impact this has had. A couple of other areas I wondered now about technologies, you've got this platform and reach, and then of course you're trying to get more data. You mentioned obviously, the earlier you can diagnose, the better. So maybe you can talk a little bit now about some of the diagnostic tools or technologies which you're implementing to improve that.
Happy to. So there is a lot of innovation that's happening with ultrasound. I'd love to tell you a little bit more about tele-ultrasound as well as AI-enabled portable ultrasound. So starting with tele-ultrasound, this is, if you can imagine, you're in the room with the sonographer, but you're potentially, they're picking up on something that's like a potential abnormality. Now, what would happen ordinarily is if we're assuming that you're not in like a major academic center or, in an urban area. That's not the broad swath of people in the United States. If there is something unusual that they're picking up, what they're going to say is, there's something unusual here, but we don't know for sure. We're going to need to refer you on to someone else. So then you'll have to schedule another appointment, maybe wait a couple weeks, not necessarily because there's no appointments, but also because you have a life and you have to take time off of work. And maybe you want to bring your family too, because this is really scary news. And so then, you drive several hours into a downtown area in order to have that. But if we could use tele-ultrasound, which is, now you're back in that original appointment, something unusual is happening. Now we can literally call in a high-risk OBGYN, they're called maternal fetal medicine specialists, and have their face literally pop up on that ultrasound right next to your scan. And he can take over the machine and direct the sonographer as well to say, move the transducer here, let's evaluate this again. So this is really innovative on multiple levels. Like from the patient experience perspective, you're getting information sooner. You could say it's different receiving, information like that through a screen versus in person. But I would say that in pregnancy, where every week does matter, the sooner you know, the sooner you can start to make arrangements and start to intervene. From a provider perspective, this enables our very overworked workforce of OB providers to expand their reach. For example, in New Mexico, we have I was just talking with this doctor like a few days ago, so he's top of mind, Dr. Michael Ruma. And so he has a command center essentially in Albuquerque, and he has multiple satellite clinics all throughout the state. New Mexico is extraordinarily rural. Sometimes moms are driving 4 hours to come to see him. It would also be a lot of work for him to go 4 hours to these satellite clinics. And so he's able to see more patients and help them understand their pregnancies and what they need to do next than he could if he had to be on the road all the time, going back and forth. So.
That's a great point you make, because we really hit home on this idea of accessibility, but clearly it's not just for the patients, it's the providers. And so the productivity saving, the patient experience improvement, clearly the longer term or even the shorter term outcomes that can improve, it's so important, these diagnostics. So it's really neat to see the way you're weaving all these things in. And Kyle, I'd be remiss that I'm sure we hear the words AI used a lot these days. I'm sure like there's something there in terms of like, well, what do you do once you get all that data?
Yeah, well, you mentioned AI, so that was a perfect segue into another example I wanted to bring up. So Philips and the Bill and Melinda Gates Foundation are teaming up to improve obstetrical care through AI-enabled portable ultrasounds. So basically, we've gotten grant investments, and we're developing a AI-based suite for our point-of-care ultrasound, which is, jargon basically for a ultrasound that fits in your hand. It's like the size of your hand. It can be plugged into your smartphone or your tablet. You just download an app through the App Store. It's amazing what this technology can do. And so now we're developing algorithms on top of that can help automate some of those measurements. The use case for this, or what is really inspired this partnership, is outside of the US. So we're looking at developing countries. And for your reference, 95% of maternal deaths in the world are in low to middle income countries. We have a big issue in the United States, but it does not even compare to the issue elsewhere in the world. So part of the challenge is that there's a lot of training to use an ultrasound. It could be weeks. And when you have a shortage of OBs and midwives all over the world, this just creates another barrier to access to care. So the AI is simplifying that. You can go from having to take weeks to learn how to use this ultrasound to just hours, for instance, because the AI is doing some of the measurements itself for you.
And it sounds like it's probably guiding these OBs too, right? And helping them identify, if there are problems a lot faster. It's just incredible, right? Because, I'm just hearing speed and accuracy right now, and I think what you're doing too with the telehealth side is brilliant. It's something that I know Richard and I are seeing actually just throughout the medical device industry. I mean, I'm seeing it in the electrophysiology space where people have, heart arrhythmias and they're doing this mapping process, and, they're bringing in a cardiologist or electrophysiologist from another part of the world to be able to see in real time what's happening with the heart, right? To say, oh, whoa, wait a second, there's a real problem here. You don't have a couple weeks to wait, to your point. So, it's definitely the at a higher level where the industry is going. And it's just really neat, though, to hear Philips, now doing this in the maternal health space, because there's no doubt that there's just so much need and value, in what you're doing.
Yeah, absolutely. And thank you also for giving maternal health this platform, such an important issue. I will say that often it is overlooked. So thank you for shining a light on it as well. A lot of the themes that we're seeing in other parts of healthcare are absolutely also happening in maternal health. Those sometimes also need to be adapted for the specific quirks of pregnancy care.
Well, it's really our pleasure. And, I think something too that we're always really interested is that, you shed light on everything that Philips is doing today. And, it would just be interesting to maybe get a sense of, where Philips might be going in the next, 6 to 18 months, with this journey, and especially with you and what you're doing at Philips to help drive innovation and, help improve access. If there's things that you might be able to touch on, to give our audience a kind of, an idea on what to expect.
Yeah, well, I mean, this is a big problem that we're addressing. We are proud of how far we've come and the impact that we have already made. There's still so much to be done, even on this issue of access to care. Like, I could spend my whole career working on making sure that people can get access to their prenatal care, and there's still be work to do. I personally am sitting in the United States. I'm very, very moved by the work that needs to be done in the United States, but there are also global challenges, and translating what we're learning in the United States and adapting it for the different needs in other countries, I think is absolutely something that we're going to be thinking about, because Philips is a global company after all.
That's right. Makes
Yeah.
a lot of sense.
100 countries.
Well, it sounds like you're doing clearly more than thinking, and I love this inclusive design approach. So yeah, for you personally, Jennifer, what's this kind of mission that you're on, and your journey and involvement with this?
So I was a consultant for many years, and I was searching for my passion and what would really just get me out of bed and feel like, just like add that next level of fulfillment to my life. And I had my first child for almost 5 years ago now. And it started off as a really low risk pregnancy. Everything was great. I was working out. I thought it was so fun being pregnant. And I had some serious complications that landed me in the hospital. And it was my first time really interacting with the healthcare system, but it absolutely drove me. And I mean, I live in Boston. I got my care from one of the best hospitals in the United States and in the world. And I felt like I know that I am very lucky. And so that's like what was personally moving me towards this maternal health space. And so when I joined Philips, I was working in the fetal monitoring business to start with, helping launch a new product, which was a really great experience for me. And I just could see so much opportunity and need for us to be doing more in maternal health. So I became very vocal about it, and I got involved. I got involved with my local community. I got onto task forces, one in Massachusetts, one at the federal level, and just started to appreciate the depth of the challenge here and how tech plays a very important role. It's not everything. Remember, clinicians use technology, so it always is in partnership, But it was a voice I felt when I was in these, various task forces, that wasn't always elevated. So anyway, I started making a lot of noise about it internally, and was very fortunate to be given a seed investment to do more for maternal health, and outside of and expanding outside of the fetal monitoring scope that I was in. So that is something that's only just started. And but I mean, for me personally, Philips as a organization has a long legacy in maternal health, over 65 years. But I am really grateful to Philips for recognizing this need and double clicking on this really important issue.
Well, thank you for sharing that personal story. And I have to say a huge thank you for your leadership. We have on this platform a lot of leaders doing incredible things. And, we don't highlight it often enough that nothing happens without great leadership and people like you who are determined to go and make a difference for patients around the world. So, I just think what you're doing is incredible. And I'm excited for all these technologies that you've discussed and touched on. For you in the next few months, I guess it's, of course, it's head down working on projects. What does that maybe, the next couple of months, 3 months look like? Is there a particular project you're working on now? Or how does that work in terms, because you mentioned you've got this startup almost that you're building. So, what's next? Is it building a project? Is it building a team?
Yes, I am building a team. I am also, I'd love to throw open my doors to potential partnerships. Everyone, as I mentioned before, it like really goes to working together within the ecosystem. Philips can do amazing things. We have an enormous platform. We have global presence. We can amplify a lot, and we have this channel. But I also believe the importance of working with the startup community, with others working in women's health, as well as our customers, providers, patients, government. That is how we're actually going to make a difference for our patients at the end of the day. Like I said, we have one piece of the puzzle, but we have to work with others to really fill out the rest of the picture. So that's something that is just always true for me, but I think very important for me right now as well. It's, viewing how we can all work together to make a difference here for our moms and babies.
Oh, Kyle, what a calling card as we think about closing out here. I mean, if ever there's a mission statement and a call to action.
Yeah, I mean, so clearly as you continue to, build your team out and you look to engage and interact and collaborate with other, potential partners and organizations, I mean, what would be the best way for folks to maybe get in touch with you too?
You can find me on LinkedIn. My name is Jennifer Law, which is pretty generic. So I use my middle name as well in my LinkedIn profile, which is Luo, Luo, Jennifer Luo Law. I think if I could ask for people reaching out to be pretty specific about how they think that they could, how we could partner. I get a lot of messages, and sometimes it takes, I have to really be creative to understand how we could all fit together. So I think we are all very willing to engage, and we recognize the importance of interacting with the rest of the ecosystem, but also being a little bit specific about, well, I think that if we had data from, one of these devices, how would that impact, how could that improve what we're working on? Just so that I can, understand the nature of what the partnership could look like.
Oh, that's perfect, Jennifer. I mean, obviously everyone wants to work with Philips, right? I mean, come on. Especially you, Jennifer. Again, your just level of commitment, passion, and just real world experiences and just knowledge, it's just like you're the perfect person to be leading these efforts at Philips. And it was just a real pleasure being able to have this conversation with you today. And again, giving you this platform to tell your story and to generate some awareness. So fantastic.
Thank you so much. This was fun.
Awesome. Yeah, huge thank you, Jennifer. A huge thank you to Philips making this investment. We can't say that loudly enough in terms of commitment and the technology that's being brought to patients around the world. So, Jennifer, thank you.
Thank you very much.
Wonderful. Well, ladies and gentlemen, another huge thank you to Jennifer Law, Maternal Health Leader at Philips. And thank you for tuning in to another episode of the MedTech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Meiklejohn. Until next time, keep innovating.